Hi, I'm Franziska Tachtler from TU Wien, and today I'm presenting our paper, Unaccompanied Youth in Mental Health Technologies, a social-ecological approach to understanding and designing. Unaccompanied youth are young asylum seekers and refugees who are unaccompanied by adult relatives. They struggle in accessing appropriate mental health resources in spite of their high need for mental health support. Research increasingly shows technology can support accessing and engaging with mental health services. However, there's a lack of understanding of how to design technological mental health support specifically for refugee and displaced communities such as unaccompanied migrant youth. We investigated how to design technology-driven interventions to integrate as mental health resources in unaccompanied migrant youth's everyday life. We conducted 2 series of co-design workshops with in total 12 unaccompanied migrant youth in Austria. As part of the study, we were particularly interested in how different social-ecological systems support or hinder the unaccompanied migrant youth's usage of mental health technologies. According to theory on social-ecological resilience promotion, a well-working interplay of different social-ecological systems is important for successful mental health promotion. In our study, we identified different social-ecological systems that interplay with unaccompanied migrant youth's usage of the mental health technologies. We identified that the macro system, namely legal policies, influences all systems negatively. We also identified different types of microsystems. We grouped them into the everyday living situation, namely other unaccompanied migrant youth at their accommodations, social contacts who are not physically close and with whom the participants stay in contact via their mobile phones, and persons of trust, such as volunteers acting as mentors and anonymous online support contacts. We also learned that chrono-systemic developments, such as changes in the way the social support structure and personal developments over time, influences the experience of using these mental health technologies. The interplay of different systems in the microsystem, the everyday living situation, is exemplary for the different interplays in this context. Here, the macrosystem, namely policies and the asylum system, influences the social and physical factors of this microsystem. The macrosystem determines unhealthy daily routines of unaccompanied youth, assigns accommodations where youth live with other unaccompanied youth who have similar unhealthy daily structures, and where every resident lacks technical infrastructure and space to engage with the mental health technologies. In these accommodations, the physical factors, such as lack of private space, and the social factors, such as social perception and the pressure by peers, ties into each other. Participants expressed concerns that engaging in mental health interventions or changing routines could be perceived negatively by their peers and that their everyday social contacts might gain access to their mobile phones and private notes in their mental health applications. We argue for the pivotal need for accounting for the macrosystem's influence when designing mental health technologies for this population, as this influence fundamentally impacts all other systems. The technological interventions need to tailor the timing, the content and means of delivery to fit with the social and physical factors of the current microsystem and be designed for trade-offs. The youth need to be able to use the mental health technologies even if the social and physical factors of the microsystem are restrictive. Mental health technologies need to support the youth in managing the different influences and roles of the different microsystems, for instance, by supporting accessing and exchanging with different types of person of trust, and managing competing tensions caused through social media apps through which unaccompanied youth stay in contact with physically distant social contacts. We also need to design mental health technologies to be adaptable to ongoing changes and be adaptable to be able to move with the unaccompanied migrant youth. We cannot design technologies for mental health of unaccompanied migrant youth without supporting ways of acknowledging and countering unjust macro-system factors. We need to explore how these technological solutions could make activist groups more proximal within an unaccompanied youth microsystem to advocate for change. We need to design towards societal transformation that would enable a more socially just macrosystem that in turn contributes to a facilitative environment in which unaccompanied youth can apply mental health technologies as resources. Thank you for your attention. You'll find more information about the research methods, the interplay between systems and unaccompanied youth usage of mental health technologies, and detailed design suggestions in the paper. And please do not hesitate to contact us if you have any questions or comments.